This is Dr. Pat Allen. She's been under upper cervical care for about 3 months, and she's going to tell you her upper cervical story.
I want you to know that I'm a doubter, especially in my own self-opinions. I am a psychotherapist, and therefore I know clients that want to believe they're perfect and everything is fine. But my symptoms were almost to the point where I was going to have to retire. I don't want to retire. I'll drive my kids crazy. I was developing a really bad case of tinnitus based on the stress of two things. Number one, that my atlas was totally out and I didn't know it, and it caused me to be unbalanced. And basically, I was getting deafer by the minute. And the stress between the imbalance and the tinnitus was such that it was getting to be so stressful, really stressful. And I come from a past of high blood pressure and really dangerous things. What I want you to know, whoever you are, is I, of all people, would have the kind of information and intelligence to say, this is foolishness, that this little bit of this and that can really make a difference in my life. All I can tell you is I have gone through much stress in my business, restructuring, just whatever. I've traveled to Europe and back. I have dealt with family, and that includes kids and grandkids and great-grandkids. And I want you to know that I think this is the third week in a row that I'm balanced. I have no symptoms of tinnitus, which is a bad thing to have if you happen to be a therapist and you're listening to people talk and you can't hear them as much as you can hear your own nervous system screaming at you. And I feel more stable in spite of whatever I'm going through than I can even remember in my life. So if you identify with what I'm saying, please feel free to do what I did. Turn yourself in, listen to what you're told, and do what you're told to do.
Which means go see an upper cervical doctor.
Go see an upper cervical doctor, particularly Dr. Drew Hall, please.
All right. Thank you, Dr. Pat Allen.